about focal segmental glomerular sclerosis. So this is a 55-year-old female with hypertension, type 2 diabetes, rheumatoid arthritis. She had severe renal stones with a history of obstruction and infection. She has diverticulitis, status post-colonic resection, and focal segmental glomerular sclerosis with associated nephrotic syndrome that's been quite tricky to treat. She has 4 healthy children in their 20s and 30s and 3 grandchildren, no family history of renal disease. So just as a background on FSGS, it's part of a genetically very heterogeneous group of nephrotic syndromes. The age of presentation is really highly variable, and there are over 40 associated genes. Large gene panel testing identifies a genetic cause in around 20 to 30% of the patients that we do test. So this is the results from her testing, and I'll point you, I guess, to first the 2 other genes listed below the gene in red, and these are both changes in recessive conditions without a second variant. So as Marina articulated and showed you the dominant pattern, this would be a recessive pattern where you would need a change on both copies of your chromosomes in order to have the condition, and she has only 1 of each of those, so we're not concerned about that. But this first one here is certainly of interest. So ANLN stands for actin binding protein anilin. This is a gene that's important in cellular growth and migration and helps with cytokinesis. It causes autosomal dominant focal segmental glomerular sclerosis 8 in just 2 families that have been reported in the literature, but it also has shown a phenotype in zebrafish as well as mice. Because only 2 families have ever been identified or at least reported in the literature, there's only 2 variants that we're aware of. And this makes it really difficult to interpret the variant, right? So it has not been previously reported. It's not common in controlled databases. It's predicted to be damaging in multiple protein prediction software programs and is the type of variant that may cause disease. So while the lab can't go to calling this a pathogenic variant and calls it a variant of uncertain significance, looking at the actual data, it's pretty convincing that this is in fact the explanation for this family. Next steps then go to how do you investigate this in the family. So we went on to test affected and unaffected family members. Her 76-year-old mother was negative for this variant and does not have renal disease. Her father was deceased, so we were unable to test him. All of her children were screened for proteinuria. Her 32-year-old son was found to have proteinuria and was positive for this variant on follow-up testing. And he is now undergoing surveillance and close monitoring. So the next step in this case is to collaborate with researchers and the folks who published those 2 families. We've collected patient samples and provided the variant information to those labs where they can look at zebrafish and mouse models and look to see how this particular variant in this family impacts other organisms.